Take a look at this. This patient was sent to me because they were having trouble swallowing. Food was getting stuck. They're getting choked up all the time. This sucks. This is not fun for anybody. Notice these rings. These rings were causing someone to not be able to swallow. There were fibrosis or scar tissue all throughout the esophagus. In fact, many people state that this makes the esophagus looks like a windpipe or the trachea. And no, I was not in the trachea. I was actually in the esophagus. These rings are a classic sign of eosinophilic esophagitis or EOE, the most common reason for trouble swallowing in young men. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. Today I'm going to show you a real procedure where we actually diagnose somebody with EOE, eosinophilic esophagitis. I'll explain what it is, I'll explain why it happens, and I'll explain what you should know if you're having trouble swallowing. So this case started with a 22-year-old young man who's coming to see me because he choked in the middle of having his dinner with his friends. Yes, it was not a good experience with him. Now, when I talked to him, he told me, yes, he's had these issues for some time, but it never got to a point in time where he actually was in a restaurant and he actually had to have, had to go outside and vomit that food out. And it got to the point where it was like, oh my goodness, something bad is going on. I need to make sure it's doing okay. Now, interviewing him, he had a little bit of reflux throughout his history. He also complained a little bit of asthma, some dry skin. And he also told me that his father was suffering from the exact same condition. So I told him, number one, this is not normal. I cannot tell you how many people think it's normal for them to get choked on food and water or pills. No, bro, not normal. Don't do it. Not normal. Come see us. We can find out what's going on. After I kind of told him this, I told him, let's do this. Let's find out what's going on. And the best way to do this is to do what's called an upper endoscopy or an EGD. So what exactly is eosinophilic esophagitis? EOE or eosinophilic esophagitis basically means you have a whole bunch of these allergy cells that are going into the esophagus. And when it goes there, it can cause scarring and fibrosis and scar tissue to occur. And as that esophagus gets scarred down, it becomes more and more narrowed in that esophagus, which means as a consequence, you'll have trouble swallowing. Pills will get stuck, food will get stuck, and water may even get stuck as well. Now, it's often related to food allergies or certain food triggers in the right setting, in the right patients. That combination can cause these allergy cells to go into that esophagus. And one of the classic signs that I see on endoscopy are these rings in the esophagus. This gives me a telltale sign that, okay, I think I know what I'm dealing with. Let's determine if that's actually the case. So what are the symptoms of EOE? Well, I mentioned that trouble swallowing. Now, it's not just trouble swallowing. It's things getting caught up, pills getting stuck. You're having to cut smaller bites. You're getting choked. These are all kind of in that spectrum. But sometimes they can be uncontrolled GERD that's not controlled with traditional medications. Maybe it's chest discomfort. You have a lot of chest pain right here. Or maybe it's that frequency of always having to wash things down because it's just not feeling right. Many patients suffer with these symptoms for years without getting a diagnosis. So how do we diagnose it? I have a clinical suspicion. They have a young man coming to see me, trouble swallowing. All right, EOE. I take a look. I see those rings in the esophagus, and I take biopsies. These biopsies allow me to find out, is this EOE or not? Now, in the medical term, you need greater than 15 eosinophils per high power field. And so if we see a lot of those eosinophils or allergy cells in that esophagus in two separate areas, I know for sure you have EOE. Well, how do we treat it? Well, the good news is it's very treatable. If there is a narrowing or fibrosis in the esophagus, I got to break up that scar tissue. I do a dilation to break open that scar tissue to allow things to swallow. And then we either will put you on dietary therapy and or medical therapy. And that will typically fix the problem and prevent it from coming back. So if you've noticed things are getting stuck, I'm choking, I can't take my pills, I have to drink a lot of water. First of all, not normal. Okay, straight up, not normal. And then secondly, don't suffer because it's going to get worse. 100% will get worse. It'll get to a point in time where it's going to end up being an emergency. Don't let that be you. As you can see from this video, it's treatable, it's diagnosable, and I can get you feeling better right then and there. If you're having trouble swallowing, if you're having bad reflux, you're like, something's jacked up in this area, come see us. We can see you today. You don't need a referral. We can find out what's going on, get down to the root cause, and get you feeling better. Visit our website, LubbockGastro.com, for more information, or call our office, 806-696-4440.